Tonight's speaker, your friend and support Child Med Day. She's a board certified physician in both emergency and family medicine. Additionally, she completed a year-long wilderness medicine fellowship and achieved the through the WMS. She's currently pursuing her DiDDM with professional interests that include expedition, dive, and space medicine. She provides medical support for a wide range of events from motocross and marathons to triathlons and air and water-based competitions. She's also served as an expedition doctor with Linbald Expeditions through National Geographic. Having traveled to all 7 continents, she's passionate about the outdoors and adventure. She's hiked, camped, snowshoed, snowmobiled, parasailed, jet skied, and snorkeled across the globe. Help me and join me in welcoming Dr. Tabassom for tonight's presentation about planning for expeditions and what you're going to do before, during, and after one.
Hi, hello everyone. Good evening, good morning. Thank you so much for joining us today, and thank you, Gina. You made me sound so good. Thank you. Um, I am so excited to talk to you guys for this hour. I will ask you to forgive me in advance. I just got off 5 days in a row. I just got home from work 30 minutes ago after a pretty exhausting shift. But I am so excited to not think about work and think about this is more fun, right? Um, so without further ado, let's start. I do want to say, please interrupt me, send questions in the chat. There are some slides that I would like everyone to chime in and participate, and I'll let you know when those come up as well. So my topic today is basically a brief overview of expedition medicine. This is such a big, broad topic, and I am trying super hard to kind of condense it into about 45 minutes and try to make it easy to understand and kind of go over things that people in expedition medicine or who want to go into expedition medicine should know. So I am going to start. And Gina, let me know if I cut out or anything. Thank you. Okay. I have nothing to disclose. And also, nothing I say here is medical advice. So please don't take it as medical advice. I just have to start my lectures with that. Um, all right, let's continue. All right. So, what is an expedition medic anyway? So, this is something that I actually didn't know a long time ago when I was a med student. I just knew that I liked medicine and I liked to be outside. I didn't even know wilderness medicine was a thing till I started attending the WMS conferences and talking to more and more people and networking. So along the way, I have learned, this is a question first and foremost to myself. What is an expedition medic anyway? There's so many layers to this question, but basically, I would say that it would involve any healthcare that's basically in a limited resource environment or far from a hospital or a clinic. It could also be somewhere where there's prolonged transport times or difficult access to patient care. Another thing is also being an expedition medic, practicing medicine outside of the four walls of a hospital involves so much flexibility. I think that's key. Every trip you take, every region you go to, whether someone has been there before or not, is so different, and each would have its own unique challenges. So I personally think expedition medicine versus wilderness medicine versus remote medicine is really maybe all on the same spectrum with different things involved in it. As part of an expedition medic, you're usually a part of the team because you're supporting them and taking care of them. So you can expect to be involved in things like going over the different participants' first aid kits, talking to them about their chronic illnesses, communicating with everyone from the team leader to all the participants to maybe the insurance company, talking to them about the pre-trip preparation, screening questionnaire, their dietary requirements, vaccinations, first aid training. It's just so much that this word means to me, expedition medic. So I hopefully I've conveyed that to you that this is actually a very deep layered job title, and I love it. Alrighty. Stages of an expedition. So, of course, it's not just going on a trip, it's not just showing up. It does involve a lot of planning for each stage of an expedition or a trip or anything you might be involved in. So, of course, we'll start off with the most obvious. There's a before, there's a during, and there is an after. Um, Now, if you're talking about the before stage, you have to look into who is going, where are you going, how many are going, do they have any health problems, or are they pretty fit, are you covered by insurance, do you have evacuation insurance, medical malpractice, look into your medical kit, see if it's appropriate for this trip. So just a lot of planning before going anywhere, especially if it's somewhere new, no one's really done it before. And then during an expedition, of course, you take care of everyone. So that it means acute care. If someone's injured or hurt in some kind of way, you're doing acute care, right? Now, if there's a natural or a man-made disaster, you might end up doing prolonged care. And so this during is basically acute care, prolonged care, and evacuation if you need it. And then after, hopefully, is the easy part. You can debrief, you can follow up on your patients, make sure everyone is back home and doing well. During the course of this lecture, I'm going to really mainly be talking about the before and the during, and not so much the after, because the after hopefully does not involve a lot except debriefing. Hopefully, everyone makes it home safe and sound. So going right into before going on an expedition. The first things first, this is a question you have to ask yourself. And this is also a question I actually ask myself quite frequently. Are you competent? Can you be the medic or the healthcare provider or the doctor to go wherever you're going and provide care to someone or many people in a place where you truly don't have a lot? Can you? So first things, do you have clinical competence? Non-clinical competence, and I'm going to talk about all this here in just a few minutes. Your own personal qualities. Do you get along with people? It's quite important, as I found out. Environmentally, are you able to go with the flow? Can you handle different environments? And also, there's such a thing as role-specific competence, and I'll mention that as well. So, clinical, let's start off with the first one that would be clinical. So, what is your clinical competence? Do you have the training? Do you have the degrees? Are you BLS, ALS, ATLS certified? Are you good at doing quick triage and assessment? How good are you at thinking on your feet and managing everything? All that goes into your clinical competence. As far as non-clinical competence, it's quite interesting, and I enjoy this part as well, but it's basically cultural competency. Like if you're going somewhere, are you familiar with their customs, with maybe their religious beliefs, their language, their food? Non-clinical also would involve things like, can you use the radio? Can you call for help? Can you figure out the satellites? Can you assess risk if you're in maybe a dangerous situation that you hadn't planned to be in and something is going south or not going as planned? Are you able to assess, like, oh, wait a minute, we're kind of heading into trouble? You don't have to be the team leader for this. You can just be a sensible person, I feel like. Do you have situational awareness as well? These are all like go into your non-clinical competence, I would say. As far as personal qualities go, uh, you're always working with a team, right? You have to be able to get along with everyone, especially if you're going to be spending prolonged time with someone. Like if you're going on maybe more than a week trip, maybe a 2 week long trip, people might not get along so well. There'll be differing opinions. There might be little friction. How do you handle that? You might have to step in and be the mediator, even though you're like, well, I'm just trying to be the doctor, but you might have to be the mediator. So You really will get to know the people you are working with, living with, eating with, traveling with. You're just gonna get real close. So that challenges your ability to think outside the box, stay calm under pressure, and be comfortable in different surroundings, adapt to where you are and who you are with. And most importantly, you would need to have excellent communication skills. Excellent. I am a shy person by nature. I am super introverted, but over the years, I have learned to get over it essentially and learn how to communicate with the team leaders, my coworkers, figure out everyone's strengths, figure out how to work together with everyone. And essentially, I don't want to be the problem. I am always trying to get along with everyone because they will talk and someone will ask for a review of you, or you want to apply for another job and you need references. You really want to be on good terms with everyone. Now, you also should be able to hopefully adapt to different temperatures, different diets, different cultures, geography, different routines. You might be getting up really early or sleeping really late, and things of that nature. You guys get what I'm saying. As far as environmental, this is super like a niche essentially, but the more skills you have, the better, right? Are you comfortable tying ropes? Do you have any mountain skills? Can you ski? How many languages do you? Oh, wait, no, just kidding. Not languages, that was personal qualities. Just kidding. But can you survive? Are you able to build a shelter? Are you able to make a fire, at least for yourself, right? You don't want to be a burden on anyone else. You have to be able to figure things out, some things out by yourself. And then I put the role specific here because sometimes you're only purely at altitude, right? So are you able to recognize like if someone has haze or hape or they're altered or as opposite, if you're doing purely dive medicine, you're on an archaeological site and someone has the bends or nitrogen narcosis and you know how to recognize it, that's a big help. You might need to know how to use dive tables and how to counsel people on should they take a break today, no more dives, two dives, that's enough because you've gone to some significant depth. It's always important. Some, I would say, medics work in war zones, work in disaster, places that have been hit by disaster or war or famine or whatever it is. If you're able to care for like blast injuries or prolonged field care, all of these things you have to take into account depending on where you're going, what you're volunteering for, what are you signing up for, right? It's always good to know in advance. Okay, does anyone have any questions so far? I just said a lot. I'm just checking. If not, I will move on. Next thing. So you've made sure you're competent. Now let's see if you have the proper training. By that, I will start off. Do you have the right knowledge and mental fortitude for environment and survival? Again, role specific. I will go over that. Disaster medicine training, wilderness medicine training, pre-hospital training, all of these things. You don't have to have all of them. Even if you have a specific training that's helpful, you can probably go on or apply for or volunteer to be the doctor for that very specific role, right? As long as you know what you're good at. And like I mentioned before, some people like through the WMS, they just do the diploma in altitude medicine or dive and marine medicine, which is what I'm doing. You can get so much training in pre-hospital medicine, disaster medicine, all of that. So whatever training you've got and whatever you're good in, it's a good thing to make sure you're registered with a national committee or a body to basically be credible, right? Keep your CME in one place, have your portfolio, make sure you have and you know all the protocols and guidelines that are nationally accepted or accepted where you're going to. Make sure you have malpractice insurance, public liability insurance, good communication in place. Like, this is my email, this is my cell phone, this is how you get in touch with me, and up to date on all your clinical skills. Awesome. Now, okay. We've figured out that we can, in fact, be the medic for this particular hypothetical trip. We're confident, we're trained, we are ready to go. You've got the job, right? Now what do we do? Now what? The trip is in 2 months. You better start planning, right? Especially if this is something of maybe a little bit more strenuous. Now, I do work as a ship doctor with National Geographic and Linbald Expeditions. So for me, I am lucky in that there are some protocols already in place for me, but I still do actually. I'm going to Baja California in 2 weeks, so I'm looking at the weather already. I'm looking at like the local diseases, all that sort of stuff. So, but first things first. What are my responsibilities? While you're planning or pre-planning, you should start a couple weeks before, get in touch with your boss, get in touch with the team leader, whoever can tell you what exactly it is you're doing. How do you document things? Do you have some sort of insurance? What is the evacuation plan and all that stuff, right? You want to know all of this beforehand because the more planning you do means the less surprises you have when you're there. The last thing you need is surprises because the more you anticipate, the more risk you prevent, essentially. This is basically a lot of early communication and a lot of communication with the team leaders and figuring out exactly what's going on. So, as far as medic responsibilities go, they're different each trip. Some trips, maybe you have a more passive role. All you got to do is step in if someone gets hurt. Great, you could do that. You're just there, you're going on this trip, you're having a good time. Only if someone's injured do you step in or say something, right? However, for the most part, and my role as well on the ship is I am involved in like sanitation duties. So basically, I have to make sure everyone's washing their hands, especially the chefs and people that are cooking for a number of people. We have to do testing of the water, make sure there's nothing growing in the tanks and all kinds of things. We also have to possibly make the medical emergency response plan and then implement it. Like if someone goes overboard, how do we get them out of the water? What do we do? Where do we take them? What do I have available to take care of these people? All that good stuff. And then also, like, for example, how responsible am I for evacuation? So for me, I would be talking to the captain and my team leader, the patient, all coming up with a plan to essentially get the patient out of there safely. The next thing, trip research. Yay, I'm going somewhere. Okay, what do I know about this place? Have I been here before? Let me let me just quickly check. What kind of environment am I in? What are potential hazards? Do they have any pandemics there? Any diseases that are currently, like, is there an outbreak of any current diseases? Local hazards. How's the infrastructure of this place? I'm going to available communications. Do we have good internet? Is it spotty? Do they use phones, landlines? Um, Are there any threats ongoing? Are they going to have a flood? Is there a tsunami about to show up? If there are any threats or anything that you are worried about, it's you communicate this to the participants in advance, along with what we're doing to protect harm to everyone. Like, this is a threat. How are we planning on staying safe? All of these things are pretty much trip research. For me, all of this falls under trip research. So now you've found some things you want to talk to your team beforehand. You can email them, call them, text them, Zoom call, whatever, but essentially give the team an overview if this is applicable to your situation. Give the entire team an overview of the public health issues that they might run into. Tell them to get the appropriate vaccines, carry their own medicines, start your malaria prophylaxis. All of that would fall under this part of the planning. Health questionnaires. So pre-trip health questionnaires, I do think are quite an important part. This is basically our homework, right? We have to get to know their health as much as we can. An essential component, I would say. It helps you to actually have personalized risk control measures, right? If somebody has diabetes, you want to make sure, for example, do you have a glucometer, even though the person might bring theirs? Do you have one? Is it working? Do you have glucose tabs? Do you have fluids, depending on where you are and what you're doing? Like, do you have ways to help and check their glucose for them and that sort of stuff? The other benefit of pre-screening questionnaires is you can talk to patients about what medicines they're allowed to bring. Some medicines are potentially banned in certain countries, and you certainly don't want to be held up because someone forgot to take their opiates out of their bag. Uh, so that's one good thing about knowing what medicines people have, what health problems they have. Now, there is an issue with this. Some people might not be honest. I've certainly run into that. You just have to talk to everyone if you can, or talk to as many people as you can about the importance of being open. Just because they've shared something with you doesn't mean they're not allowed to come. It's just that you can communicate and come up with a plan to manage whatever issue they have, because things that they might manage well at home, like you're a well-controlled diabetic, that could change when you're not at home. And I don't know, you're trekking in the Himalayas, your diabetes could go crazy, and then you're away from your normal, but you might not know how to manage it there. Or say you're away from a power source and someone needs power to charge a device, or you don't have a pharmacy. This is not a medicine that can easily be replenished. So many things could be solved or avoided by these health questionnaires. Next thing, waivers. Hopefully, whoever's going with you or whoever you're taking care of knows that there might be some danger. I think that a lot of people that go on trips know that there is always some sort of danger from something, but a waiver of responsibility, I mean, it essentially helps participants accept their own responsibility. Like they know they cannot blame the medic or anyone for something that they're doing. I think in a way it helps them be more cautious themselves and take care of themselves. I do feel like it's important. They can focus on what they're signing, and they need to be responsible for their own risk management, actually. Another thing is common or knowledge of common illnesses and injuries wherever you're going. It could be GI injuries, if you're climbing mountains, ortho injuries, environmental injuries, blisters, all that, all those injuries, like basically planning, you can get a good idea of. Okay, managing risk. This is an important slide, and it will probably take a whole other hour to talk about, but I'm going to try to talk about it in a short time. But basically, an important part of being an expedition medic involves doing a risk assessment, right? So, say you're going somewhere, you divide it into three activities. What I've found works for me: people, environment, and activity that you're actually doing. So, essentially, you're coming up with management plans for whatever risk you might run into, planning for the future, essentially. Every day is different, right? When every day is dynamic. So, the risk of things changes. So, it's not stable, it's literally changing all the time. Now, what do I even mean by risk? Basically, is someone going to get hurt? And what do you do if they get hurt? Will they need to be evacuated if they're hurt a certain way or hurt past a certain, that's not a good way to put it. What do you do if they're hurt and you can't manage it, essentially? So you're anticipating the risk and then making a plan to manage the risk and avoid it entirely. Or if it does happen, you already know because you've planned beforehand, how are you going to treat this? And is this something that is tolerable? Like, oh, they have some cellulitis. We'll give them some antibiotics and we can continue the trip. No, nothing needs to stop. No one is harmed permanently. Whereas you have an open fracture, that is something that you don't want to carry on with the trip, and you'll have to make plans or have hopefully already made plans because you thought about it to help. You have antibiotics, you can cover up the wound, you can try to reduce it and try to evacuate them. So basically what you're doing when you're assessing risk and coming up with a plan to manage risk is you don't want to do a lot of thinking on the trip. You want to do the thinking before the trip because, well, you're i- in the situation. You might be cold, you might be thirsty, you might be sleep deprived. You're human too. So it's if you have a written plan maybe or something you've already thought about, it helps it be easier for you. I hope that makes sense. And then once you actually create a document, it's best to have things in writing, communicate it, email it to your team leaders, talk to the rest of your team, give them lectures, make mini lectures because I'm sure there'll be downtime and you'll probably be bored at some point. So any questions so far? Everything good, Gina?
Yeah, everything's good.
Alrighty. Okay, finally, after all that pre-planning, let's talk medical stuff. It's the whole point of this lecture, huh? Um, Now, the medical emergency response plan, which I'm sure almost everyone kind of thinks about in their head, but we don't really have a formal template or a plan to follow. So for me personally, it's best to write everything down, and this is what I've been taught as well. So, uh, again, just like risk assessment, once you've looked at the risk of where you're going, like whether it's the environment, whether it's from people, whether it's from the activities you're doing, you're now you go into your response plan, essentially. This is the next step. So you're making a plan to be prepared in advance for as many scenarios as you can. So it's a guide to follow during actual emergencies. And so how do you do that? It starts long before departure and requires some good research. And this is actually quite fun. So got to start with doing your initial research. You've already done that. You know how many people are going. What is your role? Is it active or passive? What activities are you doing? And what are your responsibilities, right? Great, we know that. You've also done this part. You've assessed risk. You've made a list of like what could go wrong and how are we managing that, but also how are we tolerating it? Is this something that the person can continue to stay and finish the trip, or do they have to be evacuated? So what is your tolerance level of certain risks, right? Next thing, make a written plan. Basically, after you've gone on all the websites, you've researched the geography, the local climate, the flora, the fauna, the CDC, the WHO, all of these websites, you've talked to people, you have your Google Maps ready, you've done all of that. Now you make a plan. So, for example, I'm just gonna pick um, I trained in San Antonio, Texas for my fellowship. So, like, write down the coordinates. What are the major highways leading out of it? If one highway is blocked, are there smaller roads to get out of San Antonio? I don't know, are there any mountains? There's not any mountains, but I'm just saying. What are the lakes? How do you get water if you need? How do you evacuate people by boat, bus, plane, train? What are the hospitals there nearby? What is the communication like? I mean, in the city, you just dial 911 and stuff. So having a written plan, just take what I just said and apply it to a place where there's not much is a lot more difficult and a lot more convoluted to figure it out. So it's best to do it beforehand. And then once you've made your written plan, you can talk to whoever you're working with, get the plan approved. But before doing that, analyze your plan or essentially ask someone else to test your plan. Make them poke holes in your plan. Like if you've written down phone numbers for hospitals, call the numbers, make sure they work, make sure someone answers. It's almost like a game. Like, is there a plan B hospital? Do you even know how to turn the radio on and put it to the right channel? Do you know how to use emergency response devices? Do you have enough medications to last you, say you were going to go for 2 weeks, you have enough stuff to last you a month? What are you going to do if you run out of one antibiotic or out of fluids or just go crazy. Like let someone poke holes in it because better do it now than when you're actually in the emergency. Okay. So that's basically a medical emergency response plan. I've seen several uh, pictures online. Different people do it differently. Do whatever you need to do. And again, this specific slide could be a whole hour lecture in itself. and it's just so fun to look into and write your plan. It takes a lot of time too, but it helps a lot. All right, medical kits. I enjoy this part. Um, Essentially, when you think about medical kits, either you're making your own or you're buying it, right? Now, if you're making it, there's so many variables, is what I say. Like you have to know how long are you going for, which you do, right? Who are you using this for? Where are you taking this kit? There's so many online companies that offer pre-made kits, and you can use those pre-made kits and customize them for yourself. And then you also have to think about, is it just your kit or is it a group kit? And then each participant carries their own smaller kits. Are you going somewhere hot? Are you going somewhere cold? Are you going to be near water? Are you going to be only on land? Do you have a vehicle to carry your kit? Because what if it's a big and bulky kit, right? So many variables, essentially. The context is important as well. Like, are you in the city? So that way you're close to a pharmacy. You don't really need to go crazy. Or are you really remote and you should carry as much as you humanly can, right? Um, the medical expertise of the person packing the kit is important. My kit would probably look a little different from a regular bystander's kit. It might have a little bit more doctor specific stuff as well. Um, And last, you have to tell yourself you unfortunately cannot prepare for everything in your little kit. There will be some things that you will not have, and you just have to improvise, figure it out, and get your patient out. Things like if there's a child with you in the trip, which there shouldn't be, especially if you're going somewhere strenuous. But on a ship, for me, I have children's medicines and then I have adult medicines. I have child-size crutches and post-op shoes if they need it, or splints versus adults. So I just have to think about all of that. I have things to give pregnant women because pregnant women do go on ships. So it's just the context of everything. But I also know that I can't prepare for anything no matter what I do. And once I've packed my kit, one thing I like to do is pack it, pick it up, see how heavy it is, put it back down, unpack it, take everything out, and then try to pack it in a smaller bag to see if I can actually take it and go. And one thing also is to keep all your important, they have several kits. So if we're trying to get into a zodiac and it overturns and I lose my entire kit, that would be a terrible thing. So try to divide my kit amongst all the different zodiacs or boats. So I'm not gonna lose everything I have. That would be terrible. Kit design, mostly important if you're making your own. First things first, the outer shell, right? I mean, you can bedazzle it, but really, does it protect everything inside? And how convenient is it to carry, right? Personally, I like my backpack. It has straps that go around my waist, and I know it's waterproof and it will withstand pretty severe temperatures and kind of waterproof as well. Have compartments on the inside, right? Clear vinyl compartments help. You should know where everything is. That's just a given. Uh, Before every trip, check, make sure there's no dirt in there, there's no moisture, there's no insects that have wormed their way in and are living in there. There's environmental considerations already mentioned. Make sure everything's waterproof or watertight. Ziploc bags do well to keep things out for things that might dissolve easily. Medication considerations, basically not all medicines can withstand extreme heat or extreme cold. So what are you doing to mitigate that, right? Do you keep things with an ice bag if you're going somewhere? If you can do that, protect them from extreme heat as needed. And then if you're taking glass bottles, injections, needles, keep them in a hard case or Tupperware in a pinch if you don't have anything else. So all of these things can go into planning your kit, your medical kit. Um, Kit organization. I mentioned this because there's several categories of medical supplies. It could be a professional kit, my kit. It could be just a personal kit, might not be a professional kit, but it has enough to help the person carrying it. And then you could have a separate bag for only medical devices if needed, and then specialized equipment for environmental hazards or recreational hazards. And the other thing is the size and complexity of your kit also, which depends on how long you're going for, how many people you're taking care of, where you're at, the location. a smaller event or a smaller trip or expedition, everything could be carried by the maybe just the medical team, maybe you and someone else. Or if it's more remote or longer trips, it's best to divide. Take your large kit, divide it amongst many people. Again, like I said, you cannot lose your main kit. It's best to try to divide important things up so you have something in case half the kit is lost, you still have something to work with. This is a busy slide, but I just put this in like if people want to take their personal kits, this is what I would recommend them to have divided into how are you going to take care of trauma, wounds, medications, weather dependent stuff in your kits, as well as little tools like scissors, tape, headlamps, uh, and you can read it and take a screenshot if you like. But there's another table coming up on the next slide that has more things on it. But this is basically what I would tell my non-medical peeps to carry on their trip. The group kit, which is essentially the big medical kit that I would personally hopefully be responsible for. You can see there's a lot more things here, especially to like for trauma, stopping the bleed, and then closing wounds, staplers, sutures, medications, and I have them by organ system. I have respiratory, cardiac, GI, antibiotics, dermatologic, food, glucose, that sort of stuff. Of course, I'm bringing my stethoscope, my pulse ox, my um, otoscope, things like that. AED, which is quite fun. I've had to hike through forests and all kinds of things with my AED in my bag when I go on these expeditions. And this one time my AED turned on and it was a person just talking in a British voice, like all clear, all clear. And everyone's looking around. I'm like, oh, sorry, that's me. I'm so sorry. So we were forced to stop. I had to dig through, find my AED, turn it off. I don't know how it got turned on. But yeah, fun time. Oh, and here at the bottom, under tools, I have identity. Basically, which means keep copies of identification cards and emergency contacts like laminated and keep it in your bag. Just in case you want someone to know who you are or who everyone else is with you, but basically always have your identification or a copy of it on you or in your bag. Whew, all right. I'm going to take a break. I wanted to stop and see if anyone had questions. So far, we've talked about a lot. All of this was literally just pre-planning. We're not even on the trip yet, but I just wanted to see if anyone had questions. So to recap everything we've gone over so far, we talked about first seeing, do you have enough training and are you competent to go on a trip? And if you feel like you are, you got to pre-plan everything. You got to assess your risk, make a medical emergency response plan, have your medical kits looked over and nothing's expired. Look at all your medicines and everything. So, any questions?
You do have a question in the chat, and
Okay.
it's what AED do you use?
Oh gosh. It's the one that's standard on all of the ships. I don't know, I don't remember the exact brand. It's been a while. And I'm gonna go again in 2 weeks. I don't remember the brand. It was like a little flimsy thing that just popped open and the button got pressed. I mean,
That's
I
fair
found,
and fair. I don't think I could tell you the brand of an AED anywhere
nope.
like I
I don't, I am
worked
not
either,
looking.
actually. I'll pay better attention in the future though, Kevin, we promise.
I just make
You
sure they're
will
charged and they work.
Thanks. I think there's always a challenge of like Life Pack 500s are really big and bulky, but there's always the search for the packable AED that works the best. And
Oh, is
It
that
wasn't
more what
very
you're
big.
getting at? If it's like a life pack or if it's
yeah,
like,
yeah, because
okay.
the Philips Tempest Pro, Tempest ALS is pretty cool, but I've only seen a couple wilderness groups carrying that, and I'm just curious what people carry.
All
So
I remember is it was not very big at all. It fit in my little waterproof bag. The problem is we were bushwhacking. We were not following a path. We were literally climbing over logs and it had just rained and stumbling and falling and getting dirty and getting muddy. And of course, I'm the only one with a top heavy backpack and I'm not very big. I'm a short person. I kept falling over. So, it was fun and all, but I think I just turned it on myself. So.
was there any cardiac monitor, ACE, like advanced life support capabilities in your equipment?
On the ship, yeah, not
Okay.
when we were out. So
Okay.
when we take the Zodiac and we're going hiking or kayaking or whatever, my kit that I carry with me has the AED and like EpiPens and smaller things like splints and wraps and things. But I have more stuff on the ship, yes.
For people who may not know, a Zodiac is a little inflatable boat. Some people call them dinghies.
Yeah.
Um,
Yeah.
and it usually has like an outboard motor on it so that you're not taking your big ship and getting it close to shore because then you can sink your ship or ground it. Another question in the chat was, how do you decide how much medicine to bring, as in quantity, not type?
That's why you do the planning. That's so if you're taking care of, say, just 5 people and they're all pretty healthy, then you know that maybe you should bring supplies for, say, if you're going for 2 weeks, maybe just do extra and bring 3 weeks. So it just really depends on where you're going, who you're going with. Are they going to carry? It's always helpful to ask people to bring their own generic medicines also, so that way you're not carrying a lot. But honestly, I feel like people just bring the bottles like Benadryl or Pepcid, just bottles. For me, of course, I'm lucky. I have a little clinic on board, and I personally have to do inventory, so I know exactly what I have, how much I have, and I can order more if needed. So I know I'm a little spoiled with that, that I know what I have, and it will last me a month or more.
Yes,
Everything I
you
have on
base
board.
it on number of people, and you're not. We have a lot of flight medics in here, so a
Mhm.
lot of them are kind of, referencing they only bring like one or two of everything, and a lot of it's weight based, and that's not a concern of yours on this ship.
No, yeah, it depends on how your mode of transport, right? And how safe can you keep things? Yeah, you're absolutely right. Some people are limited by space and weight.
Yeah, because I go horse trekking to Mongolia a lot, and it just boggles the mind if I'm supposed to multiply, I don't know, 20 people by a month-long trip, and I don't know whatever illnesses they have. And I can't carry everything on a horse, and we go to really remote places, so I can't just order something when I run out.
Right. And hopefully you're hoping that not everyone falls sick at the same time or has the same problems, so you're not actually having to bring a lot.
Exactly, exactly.
Yeah, no,
You
makes
need
sense.
you need your own medic horse then, just for equipment.
Medicals.
Yeah, you
No,
can give it its own
absolutely.
cross on its saddle or something. Next question in the chat is, do you utilize ultrasound at all?
I have asked about this. I think so. The ship I'm on, the National Geographic Seabird, and then I'm going on the Sea Lion. These are smaller ships, and they are totally fine if I bring my own, but it's not already provided. I know some of the bigger ships, especially like maybe even other cruise lines, they do have ultrasounds and even x-rays on board. Mine does not. So essentially, my plan is to purchase an ultrasound this year, basically, as part of my kit, because I don't have one. But
Like
yes,
a
I would love to use
butterfly
it.
or like an ultrasound machine that you're going to wheel
No,
around?
butterfly. It needs to go, like, I need to be able to travel with it. So, a butterfly, or well, there's many portable ones now, so whichever one I can, I guess. But I want to. I think it's a great idea to diagnose so many things. Like if I don't have an X-ray, I can at least maybe diagnose fractures by putting the extremity in water, ocular, OB, cardiac. There's so many uses. I do want to add it to my kit. It's on my, list for things I want to acquire.
Totally. If you're well versed in it, it can instantly give you so much peace of mind or
Hmm.
diagnostic capability. Well,
Yes,
you have to know what you're doing with it, though.
exactly. Yes, the big thing, and I'm quite
Yeah.
comfortable with ultrasound. I love it. I spoke with my CMO, my boss, and he
Mhm.
said he would love to get it, but not everyone is used to ultrasounds. So he's like, if it was a standardized thing and standardized, like the doctors and whoever staffs all of these ships that he's responsible for, it's just hard because not everyone knows how to use it. So they try to keep it on the bigger ships if possible.
That's a good point.
Hmm.
Uh, Another question in the chat.
Hmm.
Um, Lee says, "Praise be the POCUS." But the next
Yes,
question in the chat. So when
we
you're
love.
going kayaking or hiking, what is the range of equipment in your kit for survival, like water purifier tablets, fire starter, etc.?
So at work, when we go kayaking, we're not anywhere like far from the ship. We're getting back to the ship. Say, because every one of us carries radios, right? So on each Zodiac, for example, like say we go off, we're away from the mothership. I have my little kid, and that's a great point. But I don't actually have anything for survival. I'll have like a blanket. We have a couple towels if somebody falls overboard. We have rope. We have life jackets. But actual survival, I don't carry anything, honestly, because we've never gone that far away from our ship. If the Zodiac is stranded or everyone's overboard, we're all always wearing life jackets, right? So essentially, the goal is to stay floating because someone around you is always, we always have eyes on each other. So someone around you will come find you, or you radio them, or the emergency flare, or something like that. So we just have to essentially not drown, pretty much, because I'm water-based. So we just try not to drown and keep people airway up and keep them from panicking if they don't know how to swim. So there's not actually, I don't carry any survival, not with when I'm working on the ships, to be fully honest. But now that you say that, maybe I should. Maybe I should carry a fire starter, some cotton balls, maybe a lighter. But also, we're not allowed to have anything that can start a fire on board, except in the chef's galley. So it's probably something I won't be allowed to take. It's anything to start a fire, unless it's maybe manual, no lighters. But yeah,
If
good
you
point.
if you work something where like say you guys went to a destination on your ship and then you had a overnight excursion on shore, you know, like you took a ship to an island and then you spent 2 or 3 days on shore
Mhm.
hiking around or something, then that would probably be different, right? So it
Yeah.
very much would depend on what type of
Yes. In
expedition or expedition program you're working.
if we were gonna do that, then I think I would change my entire bag. I would probably make more extensive kits and divide it amongst my crew because I have a trip leader and then I have several like naturalists who are all very outdoorsy. Everyone knows about survival, how to find water, how to spot like good places to build shelters and all of that. Like they're amazing. So we would all be having a meeting before we go. I would definitely bring up survival things, right? Like you said, should we carry iodine tablets? How are we building fires, shelter, if needed, right? Because I mean, normally, if you're going overnight exploring with us, you're coming back to a nice warm ship and food cooked by the chef and things. But if the other types of expeditions where, yeah, you're staying in tents, or you're camping out in a national park for several days to weeks, yeah, things are definitely different then. I would plan differently for that, yes.
Does your ship have a whole blood program?
So
Do
what,
you know
sorry?
what that means? Lee, do you mean like the ability to give blood, like a blood transfusion if someone had a massive hemorrhage or something? Or would that be an evacuation plan?
No, that is an evacuation plan. I am going straight to the captain. We are radioing other nearby ships if there's any. We're seeing how far away we are from the nearest hospital, and calling the helicopter to us if we can, if that is a capability, or basically full steam ahead, straight. I will be trying to stop the bleed and giving fluids, monitoring vitals, pretty much have stay with the patient the whole time till we make contact with whoever, an ambulance or helicopter that's going to take them to a hospital. No blood on my ships. No.
Excellent questions, everyone. That's all we have in the chat for now.
Okay, great. Good, good, good. Okay, I will go a little bit faster now. We've done most of the legwork right now. Yay, we're going somewhere cool. We're so excited. What do we do? What do we expect on the trip? On arrival, right? You get there, everyone flies in. Things to do. Introduce yourself. Hi, hello, everyone. Tell me what's going on. Is anyone sick? Has anyone picked up a URI? Any complaints right now? Let's go over all the risks. I have already emailed you and you have hopefully read. Preventative measures. Wash your hands, always, right? Or wear a mask or whatever it is. Introduce yourself, introduce your responsibilities. Go over their questionnaires if needed. If someone on their questionnaire before they board the ship, they're like, yeah, I was sick last week, or I was hospitalized for pneumonia, or whatever it is, check in on them. I'd probably check in on them a little bit more frequently to make sure they're okay. You can create individual care plans at that time, talk to people. Make sure everyone knows about their own health conditions, have their own medicines, because while you're maybe hopefully by the airport or in a bigger city, you can buy stuff if needed before you go off into nowhere. Tell them what services you offer. This is really funny to me because I mean, duh, you're the medic, but I have to introduce myself to all members on the ship, all the crew, all the deckhands, all the passengers, give them my hours, which is hilarious because I'm on call 24/7 for 2 weeks. I don't know what they mean by clinic times or hours of work. I'm like, just call me whenever, just wake me up, it's fine. But some people do only have clinic, right? 8 to 5, or they're on call 24/7, depending on what it is, where you are, and where you're going. Things to expect to do. So there's things that you must do no matter what. It's good form to do that. And then there's things that you will probably have to do. If you have patients that are sick, of course, you make your rounds. I would go talk to the crew, talk to the galley, talk to my captain and all of his mates and deckhands and everything, make sure everyone was okay. If I bandage someone up the day before, I would go and make sure they're okay today. No cellulitis, no abscess, no infections. Take care of medical emergencies as they come up. Of course, something goes wrong. Do scene management. Make sure everyone is okay. Triage. Health and hygiene inspections. Like I said, make sure everyone's healthy. During COVID or outbreaks, you have to no one's happy about it, but you have to enforce wearing a mask. Use hand sanitizer every time before you enter the dining room. Wash your hands. Stay in your room if you're sick. They're not happy about it, but you do have a responsibility to keep everyone else safe also. Doing inventory management, ordering medicines, putting them away. It's very important because you're limited. So you cannot just like lose a whole box of gauze or medicines. All my controlled medicines are locked up in the captain's room, so I have to count them with him and sign as soon as I get on the ship and then right before I leave the ship, right, to make sure there's no discrepancies, things like that. You hygiene inspections, make sure everyone's cleaning everything properly, toilet inspections, all kinds of fun things to do as a medic. Okay. Say something happened. You're somewhere, something happens. What do? You want to go help the person. That's your job. That's your actual literal job role. But hold on, take 2 minutes, 1 minute, right? Take a minute and let's assess the scene because you do not want to run headlong into injury. You don't want anyone else getting hurt. So just take a couple seconds, assess the scene really quickly. The biggest thing, right? Scene safety and securities. If there was an avalanche or a rock fall, is there danger of more rocks falling? You can't just run. Like the whole group cannot just be running towards the person. Like you have to stop everyone, be like, hold on, everybody. Yes, I get it. We want to help the injured person. We want to get them to safety, but we cannot get injured ourselves. Next thing to do is your own personal protective equipment, right? Is there a fire? Did your tank that you're using to cook food explode, for example? Do you have enough protection? Do you have anything fireproof? Are you covered? Do you wrap towels around your face and your arms? You can't just run in, right? Think about all of that. Put your mask on, put your gloves on, your glasses on, whatever you have. When I work at the Daytona Speedway and all these cars are zooming past at 200 miles an hour, crashes happen and they will not let me out of the car unless I have my fireproof jacket, my fireproof pants, and fireproof shoes, and my helmet. Like they say, like you are important. You have to be safe. You cannot just go sprinting onto a track where the rest of the cars are still going at 200 miles an hour. So that applies, of course, in expedition work as well, wilderness medicine work also. PPE is very important. You cannot be getting hurt yourselves. All right. So basically the mechanism of injury, right? What injured this person? Are you in the water? Are you on a ship? Are you on a bike? Are you on a horse? Like what happened? Did they trip over something? Did they fall off a hidden ledge? Did a snake bite them? Did a bee sting them. What is going on? Why exactly is this person suddenly laying down on the ground, right? In some instances, people who do war zones, disaster medicine, was there a sniper? Like you have to know what's going on. Was there a car accident? Did a bomb go off? There's so many things you have to think about. Are you being attacked? All kinds of things, right? You have to know what's going on. If it's safe enough, you can ask bystanders, hey, did you see what happened? Sometimes there's bystanders like, oh yeah, he was walking and he just disappeared. He fell off the ledge or just passed out or whatever it is, always helps to ask bystanders or other members of your party, what happened? You got to know what's going on. Do a little bit of detective work. Look for tire marks, look for footsteps, look for animal tracks, anything to help you figure out what's going on, really. This is all part of the scene assessment, and it's okay to go to the patient now, of course. And you can then, number of victims, is it just one? Are we sure we're not missing anyone else? Like, oh, there were two people together and we only thought of one person and the other person is also injured. Or again, if this is a mass casualty event, which can happen, like, is everyone else okay? Make sure everyone is safe. But this is all part of your scene assessment again. Support. Now, okay, you have two patients. One is more critical than the other, but there's three other people who can help you. Start delegating. One of them, open your medical kit, bring things out. Or if it's raining, have a bothy, have a cover on you, or help move. Two people can help move one person who's not as injured or help them stand up and walk away. It's basically use all the support you have around you. Someone else could be calling for help. Call on the radio, use your cell phone, or just use whatever way you can to get in touch with help to evacuate or to help the patient right now. If you can't go anywhere for several days, call the ambulance, call the boat, call the helicopter, whatever you like, and to be able to convey the message. Oh, yeah, communications. What I just said, be able to call for help. So this is all part of scene assessment. The first actual scene assessment, make sure everyone's safe, should maybe take a minute, if anything, and then everything else can happen at the same time. Like you can put on your PPE, you can be asking people what happened, check on how many victims. Is everyone here? Is everyone accounted for? All of that could be happening within the first 5 minutes. And I know in some situations, even that is too long. I get it. Some situations you only have seconds to a minute. Some situations you have several minutes to 20 minutes. It just depends on where you are. Prolonged field care. Promise we're almost near the end, guys. Thank you for putting up with me. So this is like I wanted to briefly touch on this for people who essentially have to take care of people in for longer time frames in limited resources, right? Most of us are used to conventional hospital care or pre-hospital care. You're going to the hospital, short transport times. You can turn on your lights and you don't have to stop at the stop lights. You can just keep going, right? But out in the wilderness, you have to really think about this sort of stuff. Things that you should think about, right? Okay, you have a sick person. You've moved them to a safe place where you can take care of them. You have to think about, are you protected? Is your patient protected? You have a little tent. Make sure you have your gloves on, your jacket on, your mask on, whatever. Think about environmental hazards. Like you don't want to step on a anthill when you're evacuating someone, or you've set your little tent up and there's ants all over and the patient's laying down and they're getting bit. Like all of these things have happened and can happen, and it's really unfortunate. You have a patient, 3 days to help. Make sure they have enough pain control, whatever you can give them multimodal stuff if you can. Position them, like sometimes even just raising their head or raising their legs. Give them sedation if they need it. Always think of their hydration too, their hygiene. Nobody likes to lay on the mud for hours and hours or days with a broken leg. Make sure they get fluids and moral support as well. How do you monitor them, right? You are the hospital, you are everything right now. Vital signs, and you don't need fancy tools. Like you can check cap refill, you can touch their skin. Are they flushed? Do they look pale? Are they still oozing blood? Ask them how they're feeling. What symptoms are they having? The broken leg might distract you from a rib fracture, so they're not able to take deep breaths and they're at risk of pneumonia. Ask them to pee. I mean, if you don't have a Foley, sure, ask them to pee. Hey, when was the last time you peed? How much water had you been drinking? You got to feed them. I mean, if you can, if it's a surgical emergency, toss up, right? Depending on where you are, what you're doing, feed them. Make sure they also have enough nutrition. I mentioned like move the patient. If it's getting too risky, you're near a river and the water levels are rising, move them before it's too late, essentially, right? Make sure they're just as safe along with yourself. You first, patient second, the rest of the team a very close third. Um, let's see. Ultrasound use, yay! If you have an ultrasound, awesome. You can look for pneumothorax, ocular injuries, look at the GI system, look at the heart. If you know how to use it everywhere you like. And some of the things not that I did not put on the slide is, you might have multiple casualties. What do you do if you have more than one patient? Diminished resources, you kind of have to triage who needs this pain medicine the most, the strongest pain medicine the most. Can you take Tylenol? Can you take the opiate? If there's an avalanche, you might not have communication. The lines could be down. The power could fail. You're in some sort of extremes of temperatures. So the goal for you as the medic is to offer the highest standard of care till the patient can be evacuated. The highest care that you can in those circumstances till the patient's evacuated or removed to the next level of care. Okay, let's see. Oh, yeah, documentation. Don't forget to write everything down because you might need it later. Like, when did I put that splint on? When did I start that IV? When was the last antibiotic or pain control or fluids or whatever it is? This is basically like you're in the hospital and you're using your charting system. Like, that is always important as well. Okay, so this was all so far the before and the during. I did not make a slide for the after, but basically, hopefully everyone has made it out safe. You've survived. You've found that elusive species you were looking for in the rainforest, whatever it is you were doing. You're back out, you're back home. It never hurts to have a debrief, have a group meeting, see, like, talk about the good things, talk about the bad things, what could have gone better, how is everyone doing, mental health, depending on where you were, what things you went through. Celebrate the good things, talk about the bad things, and put them away. And yay, on to the next. So that is all I got, guys. I used several references. I took this course on Rescue Expedition and Disaster Medicine by Chris, World Extreme Medicine. I've gone to several conferences, our WMS or the Wilderness Medicine Field Guide, of my own personal experiences. So I've drawn from all these different things to help me with this lecture today. Any questions? The end.
Wow,
Thank
Ayesha,
you,
that
guys.
was awesome. I don't know if it's just because you're my friend or I fangirl over you anyways, but I really think you did a really, really fantastic job of breaking it down to the basics and then extrapolating from there and how it works into this specialty. Really awesome job. Thank you so much for doing this for us.
Thank you so much for listening. It was so hard to make this lecture because it's so fun on the outside. It's so fun to be invited to go on a trip, right? You don't want to get there and be like, oh, just kidding. I'm not even prepared and I'm terrible at this job and they're never going to want me back. I know I did the preparation in my first trip with Nat Geo last year. After emailing them every year for 3 years, they finally let me go on a ship. And 2 weeks after, I got an email from my chief medical officer saying that he got a personal separate email from my regular evaluation saying that they couldn't wait to have me back on board. And I was such a treat to work with. And I was like, yes, this is all I wanted to be was a ship doctor. I've made it. So yes, planning is important, guys.
So, how about I stop screen sharing now and we open the floor so that you all can ask Ayesha any questions that you may have. Questions about how she got to where she is in her career, about she's a very active member and co-leader of the Women in Wilderness Medicine group for the Wilderness Medical Society. She does photography. She's just, one of those superhumans who does everything and is also double board certified. So, floor is open.
I'm curious about for doing shipboard medicine. Did you have to get any Coast Guard training or extra certifications on top of your other stuff you were doing for medicine?
So, no, not for this not for initially starting out. I'm only on the US flagged vessels. So I don't think so, but I do know that when we go on longer ones or when I've worked my way up and I can go to Antarctica and Australia and all that good stuff, I need more training, but I don't think I need Coast Guard stuff.
Okay.
I've done swiftwater training as part of my diploma with the WMS, like uh, a lot of other types of training and stuff, but not with the Coast Guard, no.
What's the
When
extra
I've
training?
done ship work, sorry to intervene, yeah, I've had to do US Coast Guard training, even going so far as to making us go to like a Coast Guard Academy pool and like practice putting on the dry survival suits and learning how to swim and open and climb into all the lifeboats and stuff and use flares and all of that.
Yeah.
So I think it must just be like organization specific, but it was like a 7 day thing.
What
Wow.
was it called, Gina? Now I'm wondering, I'm like, wait a minute, I have had that training. Maybe I just didn't know it was called like
I think it's like
Coast
cold
Guard.
water survival training. They put you
Okay.
in like the suits that are kind of like lobster gloves and they're dry suits and you like swim backwards and it's kind of like if you've been a firefighter how you have to get in your gear in under 2 minutes. You have to do drills to
Okay,
make sure that you can put
I've
one of
done
those
that
dry
sort of
survival
stuff.
suits on in under 2 minutes.
I have done some of that training. I don't know that I've done a formal thing, but I've done several under the diploma in dive and marine medicine. You have to go to all these conferences and have these attend specific things and learn specific. That one, STCW. Is that what you're talking about? The one in the chat?
Also, I'm curious about STCW. Okay,
What's
nice.
the full
I
form? I
mean,
know I have to do that if I go once I work my way up to the internationally flagged vessels.
The STCW trainings are mandatory if you are listed as proper deck crew. If you are an officer, I was a medical officer on a few boats, fishing vessels on the Bering Sea, and you have to do it because it has a little bit of firefighting, a little bit of crowd control. There's one for just emergency procedures on the marine side, but it's not like a medical anything. It's more like specialized to the marine environment in particular.
Cool. Were you saying something, Kevin?
Oh no, sorry.
Okay.
Um, Peter in the chat says if you're interested, look into basic offshore safety induction and emergency training with an acronym of BOSIET. It's usually required for offshore medic positions. Do people like say that as a shortcut? But BOSIET,
Yeah,
HUIT,
both see it and
BOSIET.
work for helicopter like underwater egress simulation. They flip you down under the water.
That one I definitely haven't done.
I do have training where um, they assess you to swing ropes from one vessel to a platform or from vessel to vessel. Uh, Hence why I'm not doing offshore anything anymore, but
Amy also says direct commission in the Coast Guard is an option. I did forget, Ayesha, earlier, someone in the chat asked, what is your go-to seasickness medication?
Just depends. Scopolamine or Dramamine. One of the two. Or if people don't want medicines, it's like the stare at the horizon, get some fresh air, drink lots of water. Don't be like indoors on the bottom floor because you will feel it the most and all of that. And luckily, I don't get very seasick. So, um, I see a question here. What advice would you give a first-year medical student interested in wilderness medicine? Go to the conferences. If you can't go to the conferences, do the online ones because you get a lot of networking. I did not have any mentors in wilderness medicine, and I had no, I guess I didn't know anyone who did it. So I started off by essentially going to the conferences and saying hello. Remember, I said I'm an introvert by nature. I had to quickly let go of that and really force myself out of my comfort zone. um, to make friends like Gina and talk to people, essentially network, go to lectures.
Yeah, Aisha and I actually met when I was in PA school, newer in PA school at the beginning of PA school, and she was just like she said, trying to decide if like it sounded interesting to her, but was like, would I actually want to do this?
Mhm.
And now look at her. She's got all the certs and is doing the thing and certified in wilderness medicine fellowships and stuff. So you're doing the right stuff by even just coming to this
Mhm.
and seeing if the topic interests you. And
Katie,
then,
does your
yep,
school interest group, Katie?
What did you say? Sorry.
Med schools can do wilderness medicine interest groups. Like my school has a wilderness medicine interest group that you could join. And then you're able to do like med war events where you do like medical wilderness medicine conference or competitions. And then we're doing this weekend, we're going to Mount Hood down in Oregon. We're doing a big Northwest regional, it's mostly med students, but it's all like MS1s, MS4s doing medical wilderness medicine over the weekend. Um, I don't know if you've looked into that at all.
Yeah, I've actually Mizzou has a wilderness medicine society and I'm part of it. They haven't had a lot of meetings yet, but I'm looking to get more involved. I don't know if there's a lot of uh like events happening around us, but I definitely want to go to conferences and things. But it
Katie,
just
you can also email me at wildmedwednesday@gmail and I can email you ideas of like what to bring to your wilderness medicine group and stuff to get people involved in stuff too.
yeah, that would be so great. Actually, I just sent you an email about the stickers. So, um yeah.
Yeah, it seems like the interest groups wax and wane for participation, depending on who's in the group. So yeah, definitely if you're interested in it, you could like make it everything you need it to be. But the I just myself and another med student, I'm an MS1. We both are doing the FAWM. So we're both FAWM candidates. And so we're just starting to get more engaged. And once you get into the WMS and join the society, then you start getting an influx of opportunities and it's really cool. So you get a lot of opportunities throughout the entire year.
Awesome. Thank you so much.
We're glad you found us, Katie. Kevin, I didn't know you guys had a student interest group.
Yeah.
That's cool.
It's getting pretty engaged too. It's pretty fun.
That's awesome. Ayesha, Stacy says she's an RN now, but has the opportunity to bridge to paramedic with the organization that she works with. Do you think that would be a good way to start acquiring certs for expeditionary outdoor opportunities?
I think that every opportunity is a good way to start acquiring certs because it only just builds your knowledge and your confidence, your competence and your training, like I was talking about. When I first started, I felt like I was doing the most random things and I didn't know how it would all come together. This being like maybe 5, 6 years ago, and it just did. Whatever I did, I had a template, my 10-year career goals. And I just put everything in there and found a way to honestly, make myself look good because I had to make somebody want me to be their doctor, right, on the ship. So it literally, whatever you can, and they will all teach you something that will help you at some point. Yeah.
I
So yeah.
just I just switched. I'm losing my voice. Sorry, guys. I just switched from I work in a hospital and I was bedside and I switched on to emergency medicine because it's really like that's kind of like my next step in trauma training and all of that, etc. But it's like then to get outdoors. I'm in Connecticut. I'm in the northwest corner and so, I'm not far from the White Mountains and I'm not far from we have a lot of like state parks out here and stuff like that. And so it's just like I heard them say like the marathons and the events, and that it's like I don't really want to leave the bedside. I'm not trying to get out of the hospital, but it's like I like that servitude and I like that like giving back. And it's like I'm like, what is and so I came across that paramedic program, and in the state of Connecticut, you can hold both. Like I don't have to give up my RN to hold both. So I'm like, is that it? So
Absolutely. You won't know till you try it, and you can volunteer for search and rescue organizations. I just started signing up. If I saw a marathon and they needed volunteers, I just started signing up and kind of going. Like Disney is not too far away from me, so I do the Disney marathons. And it's always good because I learned how they run their stuff. Like there's thousands of runners, so how do they plan? What is their medical emergency response plan? How are they delegating tasks? Like everything is a learning opportunity. So yeah, do whatever you can.
Legally, certification wise, like as an RN, you can do a lot of stuff. So don't feel like you need some different license than you have right now because like you can do a lot with nurse and add on certs with nursing. Like flight medics are superhero critical care things, that like supersede paramedics as far as medical training hierarchy goes in the field. So don't feel like you need to like get some different cert than what you have to do it. But having a paramedic license does give you legal privilege to make your own patient care decisions in the field, whereas other like paramedics and doctors can make certain types of decisions in the field that other different licensures can't. So that's why a lot of PAs and nurses will also have paramedic licenses because they like to do this for fun outside of their day job. Catherine has raised her hand.
Hi. So I just graduated PA school, and I'm working on putting my med kit together right now for a month-long trip. I'm going to 5 countries in Africa and going for wildlife photography, and those lenses take up a lot of space. And since you're very restricted on weight limits, I was wondering when you're putting together a kit like that, kind of how you prioritize and kind of rank like what categories like stop the bleed versus like more common things that you would want to prioritize when putting that together.
So I have to ask, where in Africa are you going?
So we're starting in Rwanda and then going to South Africa, Namibia, Zimbabwe, and Botswana.
Okay. So, and how many people are they?
So it's me and my dad, and then we're going, I think there's gonna be like 12 to 15 people when we're in Rwanda. We were in South Africa for a bit by ourselves and then joined another group. And I think there's 15 to 18 people on that one because it's a larger group that we're going with for part of it.
So if you're just making your own personal kit, it's a lot easier, right? And you can use things that have multiple uses, right? Like dental floss, tampons, rope, that sort of stuff. Or if you're not anticipating that, like you might need rope or anything, just like your little GI illness, antibiotics, like things like penicillin or amoxicillin would work for several things, right? So you don't have to carry everything. Like,
Yeah.
or if you think you might have an upset tummy, Pepsid, Imodium, things of that nature for sure. It's what I take with me all the time. And also, so I don't know about Rwanda, but South Africa is pretty urban. I mean, depending on where you're going, you might be able to replenish your kit if you need anything. Um, Zimbabwe also probably. I don't know about the other countries. I have not been there. But yeah, it just depends on where you're going. If you have opportunity, how many people are you personally wanting to take care of? Is it just you and your dad or things like
Yeah.
that? Yeah.
Thank you.
Yeah.
What a cool trip. I didn't play it smart like that. I just went straight to working when I finished PA school. God, I need more friends like you.
I got accepted to Mizzou's EM fellowship and it doesn't start till July, so I'm kind of just hanging out and figured I'd take advantage of the time off. So
Any other
Do you have any weird infectious disease that you have to worry about for your next trip?
Who, me?
Yeah.
God, I hope
Any
not.
weird regional stuff?
I think I was just looking and I was like worried. I was worried about mosquito-borne illnesses because I'm going to Baja California, which is right off of Mexico, right? So I'm still looking. I'm still doing my research. Have 2 weeks to cram everything in. But I was thinking more like sunburn, so skin protection, mosquitoes, and orthopedic stuff, which I'm lucky everything is stocked on that ship. So I'm just making my list of things I don't want to happen. And if they do, what can I do about it? Any other questions, guys? I think everyone's calling it a night, I think.
Yeah, a lot of people have started to trickle out, but not everyone. Lots of good discussion tonight. Thank you so much, guys. Peter asks, you did have to harass to get the Nat Geo position? Question mark.
So they had posted a very small job opening. A current ship doctor posted a little bitty blurb on the EM Docs Facebook group, right? I saw it when I was at an Aerospace Medical Society conference. I'm sitting there listening to astronauts talk, and I'm still Billy, like on Facebook, and I'm like, wait a minute. I want to apply. I have just graduated Wilderness Medicine Fellowship. I thought I was like amazing. I had no idea. So I applied. And for some reason, they're like, yeah, we like you. Let's interview. And I'm like, whoa, they want to talk to me. Like I am nobody and I am nothing. But you got to fake it to make it. I showed up, Zoom interview. He was really cool. And he said, we have many doctors. We're looking to add more ships and more trips, so we're going to put you on the wait list. But nobody retires from our jobs because everyone loves them so much. It's like a free trip. Like you have so much fun. All the retired docs are living large on these ships, right? So he's like, you're young, you're just starting your career. I'm going to put you on the wait list. And I was like, man, I got so excited for a few days. But so once a year, I would email him. Then finally he said, you don't have to email me every year. I know you're interested. I was like, oh, yikes. Okay, I'll just stop. But 6 months later, they emailed me and said, here's the job. I did ask him, I was like, can I give out your email? He said no. So I'm just gonna have to wait for if they have openings. There's no openings, but if there are, I will be sure to put it on my Instagram page and blast to the world. Everybody apply. So yeah, that's my story. Basically the CMO and his assistant, and they would mostly ignore my emails, but once in a while be like, she really wants this. Let's let her go. It's fine. Anything to make her stop emailing us. Just give her a trip. I don't know how they decided, but here I am.
How many trips are you doing per year?
So they want you to commit to a minimum of 14 days, right? So 2 weeks. But then I also work in an ER. I have a full-time job. So last year I did 2 weeks to Alaska. This year I'm doing two separate trips with them, one in the winter now in January and then one in the summer. It's really how many you want to volunteer for and how you make it work with your family life. I have a toddler. I don't want to leave this kid for too long, so I try not to go on the longer trips uh, for now. When my kid's older, I'll probably sign up to go to Australia and Antarctica and stuff and get more training and do more, but I'm happy with what I'm able to do now, for now, as a start.
Well, thank you so much, everyone, for coming tonight, engaging, hanging out. It just means the world to me and to everyone else who comes regularly. I'm just so grateful always that you appreciate this space and community like I do. Um, if anybody, for those who are left, knows of anybody who might want to, or any companies that you think you'd like to see us be able to give away some swag from at these events and stuff, I have a pre-canned ask for donation letter. I gotta do a little call for some giveaway supplies again. You probably noticed tonight was slim pickings compared to the past, so sorry about that, but like we learned from Ayesha, if you harass enough, you wind up with cool stuff. So here we go again. But yeah, if like there's companies that you guys think of or something, email me and I can send you like the pre-canned donation ask stuff that I have and you just send it on. Or tell me and I'll send it to them. specifically gift cards, because we have a lot of international attendees now, and it's really expensive currently to ship stuff international. I went to send someone a finger splint in Canada, thinking it would not be that much, and it cost me like $37. So that's why I'm going to start asking people for gift cards so that no matter where people live, they can just, get something. The more you know, right? The more you learn.